Hi everyone, Elizabeth here at the AAFE Training Center. In this video, we are filling some necklace lines. I have my product backfilled into ComfortTalk syringes or insulin syringes just so I have a little bit more precision. I also like having that 8mm 31 gauge needle. I find that it's a little bit more comfortable for the patient as well. Because I am doing multiple kind of serial pokes in this area, I do go ahead and topically numb just so my patient's as comfortable as possible. But I'm using a very thin product. It's important to pick a product that is not going to tindle. That's that bluish tint that you can see after having filler placed. So here I'm just kind of pinching and pulling and seeing where, that biggest deficit is. I have the patient laying back just for comfort of myself injecting. So I'm just kind of emulating what that area looks like when the patient is sitting upright. And I'm just kind of massaging as I go along and just eyeballing it really. Necklace lines are hard to fill in one appointment, in my opinion. Typically, I do see the patient back and do a follow-up just because I find that it's very hard to make it look natural. I don't want to overfill this area, and once the patient starts getting a little bit swollen, since I am using such a little bit of product, I do tend to see that patient back for a follow-up appointment, and if they need more, I can always add, but once it's placed, it's hard to take away. So I would rather just go slow and just make this look as natural as possible. And like I said, I don't really have a specific pattern that I use. I'm just kind of eyeballing it and following the crease that I visibly see and just working my way from one side to the other and just kind of massaging as I go along. All those kind of little bumps that you see are from me poking and a little bit of filler that we will massage out at the end. But again, I'm just eyeballing and now I'm moving to the other side and you can see immediate result here, but a little bit of it is swelling like I mentioned. So we will definitely be seeing this patient back for a follow-up. I did post a before and after of this patient on my personal social media account with AAFE if you would like to see that. But here, like I said, I am just following that same pattern over and over again. Nothing really different. Just making sure that I'm going low and slow and trying to get a nice retrograde of product. Like I said, we will have to smooth a little bit, but I try to make sure when I'm actually placing that I'm doing, a smooth retrograde just to keep that massaging as minimal as possible. And you can go all the way over just following the line. We're very superficial with this placement. So as far as complication goes, as long as you're aspirating and tenting and making sure you're at an appropriate depth, you are safe to be injecting all along in the neck here. So we're just going and doing some finishing touches, and I will be seeing this patient back in about 2 weeks for her follow-up.